Happy Friday, everybody. Welcome to everyone's favorite show about plastic surgery, health, and beauty. This is Nip Talk. On today's episode, first off, a celebrity touts medical tourism but leaves out all the potential risks. We're going to go over all that. And then the UK smoking ban. Have you heard of this? Is it a good idea or is it a slippery slope? And then a hospital CEO is ready to replace all their radiologists with AI. Is this a good idea? I don't know. Recent research says that maybe it's not. I'm your host, plastic surgeon Dr. Bruce Hermann. Unfortunately, Kalee is not here today. She did have an event that she had to attend, but it is in the box with me, Mackenzie. What's up? You ready for this, Mackenzie?
Yes, I am. Good to be here.
Now, you've done a show with us before, right?
Yes, once before, so I'm happy to be back.
Yeah, I'm glad to have you back. Yeah, so I guess Brenda's like on vacation or something, huh?
Yes, she is on a ranch and she's branding some cattle with her family.
Okay, she's branding cattle?
Yeah.
Like, for real, that's really happening?
For real. Can
oh
you
my
believe
gosh.
it?
No, I can't. I'm glad that you told me that because now I'm absolutely going to ask her about her cow branding.
Have her talk about it next show.
I will definitely do that. Wow, that's is that something she does a lot?
Yeah, so she grew up doing it and you would have never guessed. But she is
not
a
have guessed
cowgirl
that.
at heart.
I would not have guessed that. No. Interesting. All right, let's talk about some topics. So, sometimes we'll talk about news articles that I see, and man, some of them just really kind of get under my skin, and this is kind of one of those situations. So, this is a segment about a celebrity that is touting her medical tourism and really not talking much about the risks. Also, I was a little disappointed, like in the news outlet that talked about this, because they kind of left out all that. This was from Business Insider, which I actually have read some of their articles. Throw that article up there, Mackenzie, just in case anybody wants to check it out. Yeah. So this is if you want to search for this article on Business Insider. This is what it is, but I'm going to break it all down for you right here. So the celebrity, and I'm kind of using celebrity in quotes. I mean, this is kind of like the relative of celebrity. This is Peggy Lynn Marchetti. Do you remember Mackenzie, Loretta Lynn? I know you don't remember her, but have you ever heard of her?
I have not.
Okay, it's not. I barely remember her, and I've got 1 or 2 years on you, I'm sure. Loretta Lynn was a pretty famous like country and western singer. Like I don't know, probably like in the 60s or 70s. I think. You know, she's from a ways back, and so her daughter's named Peggy, and I don't know if Peggy's really a celebrity outside of the fact that she's the daughter of Loretta Lynn, but she decided that she wanted to go and get a facelift, and she was considering doing it maybe in her hometown, maybe out of the country, and she really got set that she was going to go to Mexico and get her facelift, and I think neck lifts as well. And of course, you know, her friends and her family, they're like, well, that's, you know, potentially dangerous, and, you know, I've read stories that people have these bad experiences, but she was pretty sad that she was going to do this, and to her credit, it sounds like that she at least did a fair amount of research, and she went ahead and she had it done. Apparently everything went okay, and she was talking about it in this Business Insider article. And one of the first things that hit me was when she started talking about the price. You know, a lot of the reasons that people go out of the country for plastic surgery or other medical procedures is because they can save so much money by doing it in a, you know, less industrialized country than the United States. You know, Mexico is really popular, Dominican Republic's really popular. If you live in Europe, Turkey is like the hot spot. And a lot of times the prices are really cheaper. I think the average price is probably about 40% of what people pay in the United States, which is a lot of savings. But what really struck me is she was telling me that, she was telling the Business Insider interviewer that she only paid 1/3 of the price of what her sister paid for a facelift. Now here's the kicker. This lady, Peggy, said that she paid $20,000 for her facelift in Mexico and that her sister paid $60,000 for her facelift in the United States. And I read that and I was just like, oh my God, like these numbers are like totally insane. You know, in the United States, I think the average price for a facelift runs like $10,000 to $15,000. So, you know, her sister paying $60,000 is just absolutely bonkers. I mean, I've heard of that. We did a story about, some celebrity that paid like $100,000 for a facelift. There are a couple people that get in with like the celebrity crowd and they, get this following and they can command those like absolutely ridiculous prices. But, the average price for these really in the United States is not that much. I think I was trying to remember in our practice, and I'm not known for doing facelifts, but I do a fair amount. Like they're just really not that complicated to do. And so even though it's not my area of expertise, I still do quite a few. I think we charge like 10 or 11,000 for a facelift. So for her to pay 20,000 in Mexico was just absolutely crazy. Like,
was the quality different?
Well, it's funny because, and I'm going to talk about my beef with medical tourism, but I went and I tried to look up her doctor, and I don't remember his name because really I don't want to like advertise people going out of the country because in general it is a bad idea. But, the guy that did her surgery seems legit, but definitely not, one, anyone I'd ever heard of, and two, that had any training that was really unique. In fact, when I looked through his training, he did basically 6 years of surgical training versus me, I did 8. Now that doesn't mean a whole lot, except that, his training was really bare bones, to be honest, for plastics. In the United States, when I was going through, it was 7. Then they did come up with integrated programs that were 6, kind of like he did. I did 7, plus I did another training program specific to cosmetic. But more tailored to breast and body stuff.
Gotcha.
So, anyway, I don't think that she got a bad quality facelift. For her credit, she at least picked a surgeon that seems legit. And I'm going to go into a little bit more of that because I do have a lot of beefs with medical tourism in general. So she ended up staying 14 days post-operative, which is good. Most people who do medical tourism don't stay that long. They'll go and have their surgery, they stay a couple, 3 days, and they go back home, which is one of the problems, as I'm going to talk about in a minute. And, she apparently did have a pretty good experience. And so I don't have a problem with her, telling people that. But I don't know, I think that it's a little disingenuous to candy coat like all of the research on this because this is something that has been studied pretty extensively about people going out of the country. So I'm going to give my issues with medical tourism. I've talked about this a million times. Mackenzie, you may not have heard me talk about it because you've only been on a time or two. So feel free to weigh in if I say anything and you're like, okay, is that really a big issue?
Sounds good.
All right, so my first issue with medical tourism is that it's basically impossible for the average person to verify the training credentials and certifications of both the surgeon and the facility. I think it's hard for people to do that within the United States. And when you add the extra layer of it being a foreign country, then it's basically impossible. And to that point, I looked up this surgeon, as I said, and it does appear that he did what seems to be a legit training program, but I cannot tell you anything about the training program that he attended outside of I think it's legit. He also did have some certifications, but I have no idea if those are the recognized and legitimate certifications for plastic surgery in Mexico. In the United States, there's only one board that actually is considered legitimate for plastic or aesthetic or cosmetic surgery, which is the American Board of Plastic Surgery. Yet there's several boards out there that people will claim to make themselves seem legit if they're not properly trained plastic surgeons. So, if I as a plastic surgeon look this guy up and I say, yeah, he may be legit, how is an average person without the knowledge that I have going to have any idea? And, then that goes into where is the person operating? Is that place legit? And so, I talk all the time about the difficulties of navigating these certifications within the United States. Outside of the country, it's basically impossible. If I can't do it, there's no way an average person is going to be able to accurately tell if the person they're going to see is really legit or not.
And don't they have different boards, like a cleanliness ranking and things like that too?
Yes, that would probably go more toward the facility. Here in the United States, I think the facility I work at has 3 certifications. It's Quad A, SF, and AAHC. I mean, I don't even remember them all. I recognize them when I see them, like, oh yeah, that's the legitimate board. So yeah, there's certifications for facilities to make sure that they're doing what's considered the standard to make surgery safe. I have no clue whatsoever what those are in a foreign country. Right. No idea. And it didn't even mention, I don't remember where he did his procedures. Like, these things are important. Like, where someone does their surgery is just as important as who's doing it.
Absolutely.
And so again, I could not figure it out from looking at this. So yeah, that's a big problem, I think, with that, or the biggest problem is, verifying legitimacy. The second is just the research on this. I mean, I've looked at these studies, a lot on, are the complication rates, higher outside of the United States? And as a whole, they for sure are. However, it gets confusing because what happens is, and we just did a segment on this, I think 4 or 5 months ago, you'll get specialized facilities. There's one place in Colombia that's actually a pretty legit place to get plastic surgery. And so they released the study of their patients. And, I mean, granted, they're releasing their own study, which brings in the question of bias. But, the results that they had were definitely comparable to the United States. And a couple things, like they actually outperformed like the average for the United States. And of course, the news media picked it up and said, oh, look, this big study shows that, going out of the country is safer than having surgery in the United States. Well, I mean, that's not really true. That's like a specialized center that is basically releasing a study to make themselves look good, and it doesn't necessarily give you the reflection of the experience as a whole, which is actually bad. There's tons of studies out there that look at what is people's experience as a whole, and the complication rates are definitely higher. And more worrisome, one of the biggest studies, which is a meta-analysis I looked, I think it was done in 2022, over 50% of the complications that people see when they go out of the country is infection. Like, here in the United States, infection is almost a non-factor. I mean, we count infections on, like, how many years has it been since we've seen a legit infection. I mean, if you're a well-trained surgeon using the methods that should be done in a facility that is, doing all the things they need to do, the infection rates are, less than 1% generally. So, the complications are definitely a problem. I see that too. I at least 1 or 2 times a month, I'll get a call about somebody who went out of the United States and is having a complication from plastic surgery, and, will we see him, or they're in the hospital and can I see him? I mean, as many as I see in just one small area, like, that they're out there.
And what are the most common complications?
Well, I mean, depending on which study you look at, like, infection is one of the biggest, which again, in the United States is not an issue. I mean, I don't say it's not an issue, but it's an issue that is, like, very, very minimized.
Okay.
But, healing problems, fluid collections, tissue loss, infection. But yeah, most studies show that infection's the number one, which is weird. Yeah. It shouldn't be like that. I mean, again, I'll pick just one surgery I do, which is breast augmentation. In 16 years of doing breast augmentation surgery for cosmetics, I've had 1 implant get infected, and that's like, that's over 1,000 implants. Yeah. Tummy tucks are a little bit. We'll see a tummy tuck infection maybe every couple of years. And I do on average 1 a month. So I'm sorry, 1 a week, not 1 a month. Like this week I did 2. Like 3 weeks ago I did 4 in a week. Wow. And our infection rates are like next to nothing. Going back to the complications for medical tourism, one of the biggest problems that happens is, as I stated earlier, a lot of these patients go and have surgery. They do 1 checkup, maybe 2 or 3 days after surgery, and they go home. And the problem is the majority of complications occur after the patients have already left the country. And then these people are in a super awkward spot. They don't have access to their surgeon except by phone, which can be challenging when you're trying to contact someone out of the country. And so these patients often find themselves in a bind because nobody wants to deal with someone's complications. Like, if I get a call from an ER and they're like, oh, so-and-so had a tummy tuck a week ago, and I'm like, whoa, stop, just send them back to their surgeon. That if their surgeon's out of the country, then that's not a possibility. And it becomes challenging for these people to find help. And then what happens is a complication that probably would have been solved if they had been able to see their surgeon gets worse, and it gets more severe. And I've seen that happen a lot. Language barriers are also a problem. I mean, it's even a problem a little bit when it's in the United States because you're talking about very technical medical things, and you have to spend a lot of time very simply explaining these things because most people don't understand medical concepts, as well as the surgeon does, obviously. And when you add in that you're trying to explain it in somebody whose language is not the primary of your own, then it can become a problem. There can be miscommunication between surgeon and patient, which does absolutely lead to more issues. And the other thing that people don't think about at all is, if you have surgery outside of the country and they do something that is clearly considered malpractice, you really have no recourse whatsoever from a legal standpoint. You can't sue a surgeon in the Dominican Republic or in Mexico. At least in the United States, if somebody does something that's considered malpractice, you absolutely can, be reimbursed for, whatever costs you might incur from complications or, pain and suffering and so on and so forth. And that's definitely not an option for medical tourism. So, yeah, I didn't like the article because the article didn't mention anything about this. It basically said, Loretta Lynn's daughter went and had plastic surgery. Everyone told her not to do it, but wow, look how great it turned out. And they didn't really talk about any of the things that are real issues with medical tourism. It was just glossed over. And I was kind of disappointed. I kind of like Business Insider. Not that I'm like a, huge Business Insider fan, but I was just like, really, this is journalism? Shouldn't there be more than one? In fact, I may send them a link to this.
You should.
I'm going to send them a link because it actually had a thing. It's like, if you've had medical tourism, send me an email. And it was like the author. I'm going to send her this, be like, hey, check this out.
And I also have a question about recovering from a surgery in general. Do you send your patients home with a prescription typically, depending on the type of surgery, for healing, or what's the healing process typically like, and how does that differ abroad?
That's a big question. Let's start with the prescriptions. Yeah, we definitely send people home with prescriptions. In fact, we oftentimes send them ahead of time, so they'll have their prescriptions before they even come into surgery. But yeah, every surgery is going to have a full list of instructions, and we go over those when they come in and do their consults. So they're aware ahead of time. I talk about them before surgery, and then the nursing staff talks about the same instructions after the surgery, and then we have written sheets for people. And then I tell all my patients, look, if you get home and you get confused, just call us. We're available 24/7, or I am. The office is there 9 to 5, but literally you can call my office number and get a hold of me at night or on the weekends if you need to.
That's great.
So yeah, and that is important because people having a good outcome does depend on instructions being followed. If people don't follow instructions, they're much more prone to problems. And so, we try to make sure that is all handled and everyone's aware so that, that minimizes the risk that people might incur.
Because I was going to say, if you went abroad and they sent you home with a prescription, and let's say you run out or you get the wrong one or something like that.
I don't know how they do it. I don't know.
Are you stuck,
I would assume they get the prescriptions in the country, and hopefully it's enough medicine to last them. It does mean that they won't be able to get refills, which sometimes is required for certain surgeries. So
absolutely.
Yeah, that's something you don't think about. That certainly could be an issue if they, how do they get antibiotics if they think they're getting an infection, or do they just give them antibiotics just in case? I don't know. And I think it varies from, person to person that you would see outside the United States. They may give everyone antibiotics or may give you some just in case. Who knows?
It's another fear.
Yeah.
At least I have.
Yeah, that's a good one. So, all right. So today we were talking about the pretty crazy story out of Business Insider that talked about Loretta Lynn's daughter, the famous country singer, who was talking about her facelift experience. And she wanted to go to Mexico to get it, and her friends told her not to, but she did it anyway, and she had a great experience. And honestly, she did have a good experience, and I'm happy for her. But my big gripe with this article is it just completely glossed over all the known risks of medical tourism and having surgery outside of the United States. One of my biggest problems with it is you have no idea the training certification of your surgeon or the facility they're doing the procedure. And they can put a bunch of things up there, but if I as a plastic surgeon can look at that stuff and be like, I'm not sure that this is like the legit one or not, how is the average person going to know that? Also, it didn't talk anything about all of the research that's been done about the increase in complication rates as a whole when people go outside of the country. And one study I looked at just recently said that 50% of the complications people have are infections, which are insanely rare within the United States. Then, one of the biggest problems with medical tourism is most people will go home after a few days, and that's when the biggest risk of complications occur, and then they do not have access to their surgeon, which becomes a huge problem because very few surgeons in the United States want to deal with someone else's issues. Also, there is the language barrier problem, which can be very, very critical when you're trying to have that good doctor-patient relationship, and problems can occur with that. And then finally, there is no recourse for medical malpractice litigation if you get botched outside of the United States. Unlike when you're in the United States, if you have some issue, you can go after the surgeon or facility that did you wrong. So yeah, I have a big beef with Business Insider on this one. They should have done a better job, and this was pretty sloppy journalism in my opinion. So, all right, moving on. You ready, Mackenzie? Number 2?
I'm ready.
All right. This one's a little bit of a controversial one. So imagine being 30, 40, 50 years old and not legally able to buy a cigarette. It's kind of hard to believe, but that's exactly what's happening in the UK with their new law. Did you hear about this one, Mackenzie?
I did actually.
Yeah.
I listened to this podcast and they were talking about it, and I was kind of blown away.
Oh wow, we're about to have our own podcast about it.
Yeah, let's do
we'll
it.
See if maybe you can maybe they thought of smarter things to say than I did, so you'll have to let me know. So the UK has actually passed a smoking ban of sorts. And so, I think the big question I have is this a good idea or is it a slippery slope? So what they basically passed was a generational smoking ban, which means that the legal age to buy cigarettes is going to start to increase by 1 year every year. And so what that means is if you're born after January of 2009, you will never legally be old enough to buy cigarettes within the UK. Every year, the age to buy them will go up by a year. So it's obviously not making smoking itself illegal, but it is making the sale of cigarettes illegal for certain people, which is really just a ban on access. And so, why are they doing this? Well, obviously smoking is bad for you. That's not up for debate anymore. Smoking is not good for you. In fact, it's one of the most, it's one of the worst things you can do for your health. Every year in the United States, I think 300,000 people die due to smoking-related illness. In England alone, it's 65,000 deaths. And so, why is the UK doing this? Well, it also costs the system a lot of money, and the UK does have the National Health Services, which is a government-run healthcare, and so they undoubtedly are doing this to cut down on the average 3 billion I don't know if it was euros or pounds sterling that are spent every year to treat smoking diseases. I mean, this is absolutely one of the most aggressive preventive health policies that's ever been attempted. And all models do show that this absolutely will cut down on the rate of smoking. Even if people try to get around it, it is going to have a pretty big effect. So,
absolutely.
I don't know. I think this is definitely controversial. I mean, what are your thoughts? You listened to the podcast or whichever one it was. You saw the news. What do you think?
I'm kind of torn.
Yeah.
Because I get it.
Yeah.
And I'm not a smoker. I've never smoked before. I studied abroad in Spain and made it out without smoking.
Wow, that's impressive.
If you can believe it. So I'm definitely not for it. But I do get the right of choice, and especially when you're older, some people are addicted and they want this cigarette every day, and it's hard to quit. So I see why they did it the way that they did, so that the younger people can't get addicted to it. So if they were going to do it anyway, this is the way to
as
go
opposed
about
to
it.
An outright ban.
Yeah, if you just outright ban,
smoking.
because then it'll make people want it more too. If you just ban things like that.
So I mean, I think you can make arguments for and against this. The arguments for it, number one is exactly what you said, Mackenzie. That's really smart. That it prevents the addiction. It prevents the addiction from ever happening. Obviously, it saves lives. It is going to reduce the burden on healthcare. And in reality, it's very similar to helmet and seatbelt laws that we have hit or miss here within the United States. Arguments against this, I mean, it is generational discrimination. It's basically telling some people of a certain age, okay, you can do this, but you're younger, no, you can't do this. And that does become a little sticky. Also, I mean, this is my big concern, that it's just a slippery slope. I mean, yeah, you're going to save money by banning cigarettes. And it's like, what's next? Is alcohol next? You know, is sugar next?
Yeah, you lose that freedom.
Is like riding a motorcycle next? You know, is having plastic surgery next? I think to me that's like the biggest thing that I have an issue with. The other thing is there's always that black market risk. I mean,
absolutely.
I mean, we don't remember prohibition, but we remember learning about prohibition in school. Prohibition was not good.
Yeah.
You know, when they made alcohol basically illegal, I mean, it opened up a ton of organized crime. You know, I mean, normal people were getting locked away for, you know, having a bottle of whiskey in their house.
Especially if it becomes like a felony or something. And it's also like you have the right for choice. And is the government doing this?
I mean, maybe you don't.
Maybe you don't if you're there. Maybe that's an American viewpoint. But
yeah. You're 100% right. Also, it does become an enforcement nightmare trying to, you know, like make sure that this actually goes through. I mean, that's to me like a lesser issue that, you know, really is not as big as the other one. So, all right, so my take on this, you know, from a purely medical standpoint, like this is a great idea, okay? Purely from a medical standpoint, smoking is terrible for you. That's been well established that it's not good for you. And, you know, smoking is one of those things where not very many people just do it, you know, a little bit. Like people do get addicted. They do tend to, you know, really push the limits of how much, you know, cigarettes they're taking in. And it's absolutely insanely bad for you. Now, practically and as an individual, I absolutely hate this. I absolutely do not like the government telling me what is good for me. You know, I really worry about the slippery slope of, hey, look how much money we save by banning cigarettes. Now let's ban alcohol or, you know, riding a motorcycle or other things. And I really believe in free choice. Like, I mean, this sounds crazy, but I'm not a big believer in like seatbelt laws or helmet laws, even though I personally always wear my seatbelt and I always wear a helmet when I ride a motorcycle. I just don't feel like the government should force you to be safe. I mean, what are we if we don't have free will and free choice? And so I don't know, I guess I don't say morally or like philosophically, I guess, I have a huge problem with this.
I get that.
Even though I know it's like good for society, I just am a big believer that the free choice of the individual trumps, you know, the good of society as long as they're not hurting someone else.
I agree.
You know, I mean, if they're hurting themselves, hey, it's your life. And I just don't trust the government. I mean, you know, I don't know if anyone trusts the government these days. I would hope not. But I mean, you know, trusting the government to tell me what's good for me is, I
don't trust them either.
I just don't. I don't trust the government.
And it's also scary because it's like you said, what's going to be taken away next?
What's going to be next, right?
And
it's just like, you know, I have a really big problem with this. I'm not surprised it's happening in the UK. I don't think this would ever happen in the United States because, I mean, Americans in general do not like to be told what to do. And like, they're willing to just die over it. You know, it's like, we're not afraid to like just get crazy if people start taking away our rights.
And it might backfire because I know if someone tells me not to do something, it
right,
makes
I'm
me
gonna
want
do it
to.
harder.
Yeah.
I'm gonna smoke 2 packs a day.
Yeah, so that's just me personally. Maybe it's a me problem. But yeah, I don't think that would deter me. And you'd think it'd take resources away, like you said, from other real crimes.
Exactly right. Like they're gonna have to put a lot of resources to this to enforce it. Meanwhile, like people are over there getting knifed to death and whatever. And it's like, what are we doing here? Like we're like putting people in jail for, you know, the other thing they do is you get put in jail for your social media posts. You get in jail for buying cigarettes.
It's
like
scary.
It's very dystopian. Like sounding when you say these things out loud.
And the way that they go about it too is like, oh, we're doing this for you, for your health.
Oh yeah, this is for you. Like trust us, this is good.
To save money. So I don't know if I like that either.
Yeah, again, I do agree with the fact that it's beneficial, but man, I don't like it. And I would not support this, even though I would support people not smoking, you know, 100%. You know, it's like, don't smoke, it's bad for you. I mean, or if you do, just be aware of the risks, you know? I mean, you know, you're harming yourself, and if that's what you want to do, I mean, go for it. But wow, I don't know. I don't like this.
Yeah, it's kind of creepy.
Yeah. All right, I'm going to recap this one real quick. Wow, have you guys heard what's going down in the UK? Can you imagine being 30 or 40 years old and not legally being able to buy a cigarette? It's kind of crazy, but that's what the UK has done with their, for all intents and purposes, ban on smoking. Now, it's not a ban on smoking. It's a ban on access based on age. So what they're doing is they're raising the legal age to buy cigarettes every year by 1 year, which means if you're born after January 2009, you will never be old enough to legally buy a cigarette. And so this is a little bit of a controversial thing because on its face, getting people to stop smoking is absolutely a great, great thing. Smoking is one of the absolutely worst things you can do for your health. Every year in the United States, about 300,000 people die to smoking-related issues. In England alone, it's 65,000. And it does cost a lot of burden on the healthcare system, which is probably why the UK is banning it, because it's costing them money. Now, although I do agree that on its face and from a purely medical standpoint, this is a good idea, I absolutely am against this from a philosophical and moral standpoint, because if there's one thing I believe in, it's I believe in the choice of the individual, and I don't trust the government to tell me what is right for me. I think that if people want to smoke and they understand the risks, as long as they do understand the risks, then that's their right. I mean, what's next? This is just going to be a slippery slope. Look how many lives we save by banning cigarettes. Let's ban alcohol. Let's ban, sports like riding a motorcycle. Let's ban skiing. I mean, where does it end? And maybe you think that's a joke, but it absolutely can happen. You start banning one thing, and then it just gets out of hand because the people let it happen. So, yeah, I'm against this. There's no way I would support that, even though I do agree that it is good for the health of people. So, yeah, good controversy. All right, last one. Mackenzie, you ready?
Yes, sir.
Okay, are you an AI user, Mackenzie?
Lightly.
Like a light AI? Are you an anti-AI person?
No, I'm not anti.
Okay.
I'm AI when it can help me, but I'm at that point right now where I'm like, I don't trust it fully. So like, I'll have ChatGPT
absolutely not.
do an email
No.
and then I revise it.
Totally, 100%.
So I'm like a half, only for help.
I think that's the best way to go about it. I talk about AI on the show all the time because I actually really do like AI, but I 100% agree with the things that you said about, you just can't absolutely trust it. So also, I'm going to throw out here before I announce this title, I did call this one. I called this. All right. This is a segment about hospital CEO in a major hospital chain in New York says that he is ready to replace his radiologists with AI software. And this comes from, I thought, a really kind of entertaining and interesting article from Futurism, which I read them from time to time. Throw up that pic, Mackenzie, the Futurism article if people want to look it up. Yeah, there it is right there. America's largest city hospital system ready to replace with AI. Okay, so the CEO of New York City Health and Hospitals, whose name is Mitchell Katz, he represents 11 major hospitals in New York, was on a New York business panel, and he says, and I quote, "We could replace a great deal of radiologists with AI at this moment if we are ready to do the regulatory challenge," which basically means that they're going to have to change some things to be able to replace, these physicians with AI, and they're just not quite at a regulatory point where they can do that. He went on to say that if he does this, or if he's able to do it, the hospitals would achieve major savings. Well, of course, when he did that, a lot of people just completely came unglued, including a bunch of radiologists who had some really funny quotes in here. Basically, one of the radiologists said, "This is absolute proof that uninformed hospital administrators are a danger to patients." He went on to say, or another one said, "Administrators are easily duped by AI companies that are offering these, great improvements." And finally, that hospitals are happy to cut costs even if it means patient harm, as long as it's legal. Man, they really kind of went all barrels on this dude about the fact that not only is he not being smart, that he basically just doesn't care about patients in general.
Rightfully so.
Yeah, and so so I'm gonna go in with a few things about this. One of the more interesting things that the article did have was a link to a Stanford article, like a research article that they were doing where they were looking at the results of AI radiology programs. And one of the big kind of red flags they found is that they were basically asking it to review an x-ray that didn't really exist in the system, and the system was coming back and giving a read for an x-ray that didn't exist. And if you're really a heavy user of AI, you probably have heard of hallucinating. Have you heard of that, Mackenzie?
I haven't.
Okay, so I use AI for a lot of things. I build custom AI bots.
Sweet, that's cool.
Yeah, they are they're super helpful. Everything I've made a bot for really has improved my workflow. But there is a phenomenon called hallucination where, especially when AI is looking at something that has a lot of data, it'll start to fill in the blanks, meaning it'll like not look at the entire document, but it'll skim it, and it'll put in what it thinks is in between that.
Interesting.
And so I catch my AIs doing it all the time, and so the way I get around is I never ask it to do anything like that. I only ask it to do simple tasks where it will be helpful, because I know if I try to have it analyze, a 20 or 30 page document, it's going to completely go off the rails. It'll get part of it right, and then part of it it'll just completely make up. And I have friends who use AI for like coding, and they say that it's the exact same problem, and it's just a way that at least the large language models work right now, where they kind of fill in gaps to basically become more efficient. Now, I've always wondered if you had like an unfettered AI where it didn't, wasn't basically programmed to do such things, if it would completely eliminate the hallucination or not. And this paper out of Stanford makes me wonder if maybe even unfettered, it does the same thing. Because anytime an AI is basically making up data for something that it never even looked at, that's worrisome. And especially when it's someone's health. What if it's making up, oh, this is a normal x-ray and they have cancer?
Right.
So yeah, I was kind of surprised to see that article that showed this really big glaring problem. The article also talked about the concern about AI's ability to recognize visual material. And I personally have had issues with that myself. One of the AI bots I created is for, of all things, coin collecting, because I'm like a super coin nerd. And I'll take pictures of coins and I'll throw it into the AI, and it'll look at things, and I'm like, dude, that's just absolutely not right. Like, are we looking at the same thing? And I'll be like, hey, what about this? And they're like, oh, right, yes, now that you mention it, thank you for calling me out on that. But yeah, I did actually mess this up.
It definitely needs human eyes.
Yeah, I kind of agree. And it's funny because I've been talking for a long time about AI and the fact that there are a lot of jobs that are going to be in jeopardy, and talking specifically about medical jobs. I've always said radiologists and pathologists, which basically are, for the most part, interpreting data and spitting out a result. Like, that's really what AI is made for. And I've always said that these specialties are going to be at risk. But now I'm kind of like wondering, like, okay, maybe they're not as good at analyzing visual data as I thought. They are really good at at analyzing analytical data.
Yeah.
But maybe the visual is not there. I don't know. I still do think, though, that it's probably only a matter of time until this technology gets refined. Maybe it's not ready yet, but man, I do think it's coming.
It's definitely a better assistant, I think.
I do too, and that's how I use it. I never let my AI bots do anything for me.
Yeah.
I have them assist me to do what I'm doing, where they're not really responsible for anything. I'm just using them as a resource. And I've had great success with it. Man, I've really been able to do some pretty amazing things using my bot. And again, I like the custom ones myself. Like you basically take like a standard bot and you program it to be really, really specific at a certain task.
That's really cool.
And man, they are good. So, but yeah, I don't know. Like, also this hospital admin. This is pretty classic for hospital admins. In general, I don't like hospital administration. There are certain hospital admin people I do like. Like, I consider some of them friends. But like as a whole, I do have concerns about a lot of hospital admins really only care about the bottom line. And I've seen that. I've been in medicine a long time now. I've worked with tons of CEOs over the years, and hospital administrators, and there's been times when something will come up where it's like, It's a choice between this is really, really, beneficial for patients, or this is really going to save the hospital money. And I see them going towards the dark side, more times than not. And so this guy saying stuff like this is just so on brand for like my, my stereotype of hospital admins. So we're just like, oh, this is going to save everyone a lot of money if we do this, But, is it really the best thing? I mean, it sounds like it's maybe not right now, although I think it's coming.
Yeah, I definitely think that we've made great strides in refining AI, but it just makes me think of that
great
story. Have you heard of, I think it was it in the UK or the US? It was with Luna, the AI bot that was given a bunch of money to run a business. And
Okay.
Luna was able to hire a bunch of people to work for her. So she had a storefront, and she had a bunch of content, like mugs and things like that. And so she set up the whole thing, and they found that she was given like $10,000 or something, blew through it all. She spent like a bunch on toilet seat covers, and then instead of putting price tags on things, she would have people call in to her and she would tell them how much it would cost. And so like AI definitely needs guidance, and that was the result of the study, that if you just give them free rein, they won't be able to be a human.
Yeah, I don't think that like Skynet and the Terminators are quite here yet, but I don't know, like it has gotten a lot better in the past few years than it was. I mean, even, prior to the explosion of ChatGPT, AI was kind of an afterthought. I mean, you'd see it and you'd be like, oh, it's AI, it's terrible.
But now it's gotten a lot better, even in
better.
terms of like image creation and stuff. But the most recent AI in the medical field that I've seen is just like going to the doctor's office for my annual. They'll like use AI to like take notes, and so they could be present. And I really liked that. But this part, I'm a little scared.
There are some like great uses of AI in medicine, and that's like, one of the biggest issues in medicine, not to like get off topic here, is, all of the just overburdensome paperwork and busy work that now goes along with being a physician. And AI does have like a great ability to streamline that. And honestly, to me, that's like probably one of the best uses of AI, is just streamlining some of the work that everyone hates to do and is, basically overburdening the system and, wasting people's time. Get AI doing that. That's like, to me, a great use for it. So all right, I'm gonna recap this one real quick. So a New York hospital CEO just went and said that he's ready to replace all his radiologists with AI if they can change the regulation on that, and went on to say that it would save the hospital a ton of money. And of course, radiologists were quick to roast this guy for that, saying that this guy only cares about money, that he's a danger to patients. And you know what? Some of the current research says that they actually might be right. There's some research out of Stanford showing that AI radiology programs will sometimes hallucinate the results of images that they never even seen, a phenomenon that people that use AI a lot know does exist, which is kind of scary if it is absolutely happening with programs that are involved with medical care. So I've said all along that we are not ready for the AI revolution. AI is going to change everything. I have said in the past, I think radiologists and pathologists are two specialties where AI is going to hit the hardest. I don't think it's there yet, but it was interesting to see this hospital CEO says that he's ready for it. I think probably he's just been, suckered in by an AI company that is promising results they probably can't give. I don't think the technology is there for it to be safe yet. I mean, AI can do amazing things. Interpreting images still is a bit of a question mark for it. So yeah, I don't think the radiologists need to like find a new profession yet, but I don't know, in the future, who knows, but we'll keep you posted. So, all right, Mackenzie.
This was fun.
Good work. You did an excellent job filling in. Thank you so much.
It was a blast.
I really do appreciate it. All right, everybody. Thank you guys so much for tuning in. We really, really do appreciate it. Please crush that like and subscribe button. And if you want us to talk about a topic on this show, you leave us a comment, and we will do it on the next episode of Nip Talk. Bye.